All right, so to get going, I just want you guys to, you can either write it down or just think about it in your heads, but I'm just going to ask you a few questions, and I just have a think about it and jot it down if you want. So the first question is, what name do you like to be called? The second is, what are you most proud of? And that can be, just think of the first thing that comes to your head. What are things that cheer you up? For me, it's my cat and husband, but it's probably the other way around, but whatever. What things worry you? I hate needles. I absolutely hate, I'm a nurse, I hate needles though. And is there anything else you would like to share? So just have a think of those things, and then we'll get back to that in a second. So when you have a look at this, if I came into a clinic, and I've been actually going to a sports rehab clinic for the last 5 years, but if I came in for the first few times, or any clinic, a PD clinic, would you know these things about me? And there's my husband and cat, they're together, the thing. But would you know that I'm obsessed with skiing? And there's 2 pictures of my cat, so obviously I'm really obsessed with my cat. And the reason why I put these up is when I was working bedside, I would be looking after patients. They'd come in, and this one guy stood out for me. He came into the unit, intubated, sedated, woke him up after 24 hours. We extubated him, and the first thing he said was, "Who's looking after my cat?" And we freaked out. We did. We found his keys. Myself and a social worker went down and rescued his cat. And that was a huge thing for him, because that was the only family member that he had. And if the information that was missing for him was, if nobody was looking after my cat, what's going to happen? What's going to happen to their cat? What's going to happen to me? And that was a huge thing that was worrying him. And because of that, he couldn't take in any information. So once that little tiny piece was sorted out, it made a huge impact on the care for him. He was ready to accept what his diagnosis was and then move forward. And it was just by, finding that little bit of personal information that I would not have found on a patient Cardex or a patient profile. So then that got me thinking, well, what is out there? Like, I know the social worker collects really valuable personal information, but is there anything else out there that I can give a piece of paper to the patient, they can fill out themselves and tell me about who they are? And so I started investigating, did a lit search, and NHS have some great stuff out there. NHS Scotland, VGH ICU has started something as well. Out east there was a patient profile, but there really wasn't this tool where you could gather important information of patients' values, who they are from their perspective, as opposed to me taking it from my perspective of them. And then once that information is collected, and sometimes it is, when the patient transitions to another unit or another department, that information is lost, or I can't find it. And then I'm scraping again, trying to find, sift through the chart, trying to find out, who is this person? Who do they need by their side? Who knows them the best? So this was actually, the person's not a real person, but the answers are taken from somebody. And so I went to, I wanted to get out of the ICU and go to somewhere, play in another area. And so I approached the dialysis program at St. Paul's Hospital. And I went and approached 2 clinics, really. In fact, they were awesome. They really approached me. I came with this idea of, hey, I've got this idea. Do you want to test it out and see what happens with it? So I worked with 2 clinics, and it was the PD clinic and the kidney care clinic at St. Paul's. And what we found was, we did find that there was a gap in quality where patients were really unable to create their own snapshot of their personhood. That was separate to the current social histories that a social worker was taking. So what we decided to do was, our aim was, all patients presenting to the kidney care clinic and PD were given the choice to create their own personal snapshot. They were given a blank piece of paper. They could fill it out with family, they could fill it out themselves, and then they could choose whatever photo they want and put it on there. And that was an important piece because I don't know how many of you guys have looked into a patient chart and there's a photo of them and it's taken from like this angle, so they have no neck, they look squashed, they look miserable. So it's like, bring in your own photo and show us who you really are. And so we developed a couple of prototypes, tested them out. We did PDSA cycles like Plan, Do, Study, Act, looking at different transition points as well. You know, when a patient comes into the PD clinic, where are the different points where we could grab them and go, hey, do you want to fill this out? And then just leave it up to them. And then we kind of just took it from there, really. One of the clinics, we also did a pre-survey. And what we looked at was just, the current care experience. And they just asked them information, really, would you want to share information with healthcare providers? And from that, we found, we just surveyed 30 patients who got 30 surveys back, which was amazing. And out of that, 80% were like, yeah, I want to share other personal information with my healthcare providers. You guys already asked me amazing questions, but there's other things I want to let you know. I'm having PD, but guess what? I'm an author. Guess what? I'm a gardener, and I want to get back to that. And these are just extra information. So, like I said, how this forum is, and it's another tool, and I was really conscious of that because we're always giving nurses and healthcare workers more and more tools. The main thing about this for them I wanted to share was, what is the impact of filling out this tool? What are you and the patients going to see and notice in the care that's delivered when this is filled out? And so that was a huge big thing for me to make sure that was sustained. So the patients are given the form, and like I said, they can fill it out there, they could take it home. They have the choice to tell the healthcare providers, you can have a copy of it, or I'll keep it and I'll bring it to my clinic. It's giving it back to the patient, giving them back that power. They can update it as many times as they want. There was one guy who, I think he got married 3 times in the last 2 years. So it's like, how's your wife? Which one? So it was kind of like, you know what? Because it was kind of like, how often should we update it? Should it be yearly? Should it be quarterly? It's like, let the patient decide that, It's up. This is their tool. Give them the power to do that. And so what we found when we were testing out the different, doing the different PDSAs, we found that the most valuable area for this was at that transition point of when a patient is moving from a clinic to a different clinic, say from kidney care, either going to hemo or going to the PD clinic, or if they're actually they're at the clinic and then they need to be admitted and they've come into a ward, say a medical or a cardiac ward, an area that they don't know. And so what I found really, so you can see on the second question there, what was really interesting, important people in my life. This man put down Linda, but then he wrote down the PD clinic nurses were important. So for me as an ICU nurse, if I open up the patient's chart and see that in the front and I'm trying to figure out who this guy is, I can't contact his wife, but he's put down that the PD clinic nurses are important, they're going to get a phone call from me and going, hey, I've got Jim down here. Can you help me out? I need to know more about him. That would remove so many steps of calling and sifting through charts. I can get somebody down to help me out. I can continue caring for him. So the next steps really, and with quality improvement, the first step really is sustaining something. We're still in that process right now. We have, and I do have to shout out to Cara and Clay over at the PD clinic in St. Paul's, who have just been absolutely amazing, incredibly supportive. They have taken this and just gone with it, so the sustainability piece tick. It's just awesome. It's like, they've taken it to the point where I can just hand it over and walk away, and now it's up to them to just give it out to patients. And I think that's a really good place to keep this form at the moment. Like how we heard earlier, it's very well putting in processes for quality improvement, but the biggest piece, and when I was working as a change specialist, the biggest piece is that changing behavior and changing practice, and that's always the bigger thing, and that takes a while. Don't rush it, let it evolve by itself, and that's kind of where we are at the moment with this form. We do also have the hemodialysis unit, especially at the transition point, are really, really keen on taking and using this form as well. So they're going to start playing with it, and we're going to track it and just let it evolve and be organic by itself. So just coming back to those questions that I asked you guys earlier, we're probably about 8 months into implementing this form at the kidney care clinic. I got a call from one of the nurses, and she said, "Hey, I just tried out this form, and you just wouldn't believe what happened." There was a guy who was coming in. He's been coming into the clinic for about the last, I think, 3 years. So he's had at least 6 visits minimum. Every time he came in, grumpy, pissed off, rushed, and then he wouldn't even stay for all of his clinic visits. He would just run out of the room, and they just couldn't get to him. They just didn't know what was going on. So one of the nurses she sat down and said hi to him, and she just gave him the form and said, "Hey, can you just fill this out for a minute? I'm going to grab some things." Left the form with him, left the room, came back about 10 minutes later. He'd completely filled it out, and he was sitting there going, "I need to tell you all about me." And she's like, "Okay, go, tell me who you are." And he's like, "The reason why I'm always late is because," he's like, I was in the war, and from that I've had bowel problems. I'm getting that checked up, and that was being checked up for the last 3 years, even though it wasn't even on his patient record file. So that was a huge thing. He was being seen by a GI specialist, and that wasn't on there. Because of his bowel problems, he always had to go to the bathroom. It came on spur of the moment, and he was embarrassed, and that's why he would always run out of the room. And then he would feel embarrassed that, "Oh gosh, I've missed another appointment. They're going to be angry at me. I don't want to come back. I'm just going to go home." And that had been going on for the last 3 years. And he said, "Now you know what's going on." And she's like, "Yeah, so let's start again. Hi, my name is blah, blah, blah. What can we do to help you next time you come in?" And it was just so powerful that this one little form made this huge difference for this patient. And the last thing he said to her was, "I'm really looking forward to seeing you in a few months' time." And she said, that just made my day. So the challenge I'm going to give out to you guys is give it a go. If you guys want to try out this form and play with it, give it a go. Have a look at, you know your patients really, really well anyway. This is looking just a little bit more deeper. So I challenge you to just give it a go and see what happens. Thank you. Any questions?